We did a research walking around the regions and with my colleague. They are not allowed to have an insulin and diabetic treatment at the level of dispensary.
Okay.
Yeah, that's why there are many people coming to us. Yeah. And you see the level of dispensary, those people who are taking care of the patient there, I think the level of the education to manage the diabetic people is not possible. No. Because you see the diabetic patients, some of them are admitted, some of them they need special care, then in a level of dispensary cannot be managed. At that time we have been doing, and I think it's that Mr. Malvin has funded that outreach, and now nobody is funding.
I was working here mostly in Lena ward pediatrics with the ground staff, nurses and doctors. We have started a program for children with spina bifida and hydrocephalus. So there is a huge amount of babies being born, and especially in this area with a spina bifida, which is a disease of the spinal cord, right, not closing. So we see a lot of those babies being brought to the hospital, and those kids need surgery. They need the spine to be closed, of course, in order to prevent infection. And then, especially after, those children can develop issues with walking. Most of the time they're paralyzed because of the spinal injury. So, twice a year we're having Spina Bifida Week, we call it, Continence Week, where all the children that have had surgery at Haydom, whether because of hydrocephalus or of spina bifida, they come with their parents for 1 week of training. When we know we plan a week of spina bifida, we always do it in May and in October, so that makes it a little bit more simple for the parents really also to plan. And we announce it already on the last day of our spina bifida day, so we announce that there will be another week in October or now in May. But then still again, Henry sits down maybe 2 or 3 months prior, and he's calling each and every family by phone to let them know to start their travels in time to be here when it starts, and that works quite well. And also the parents now, they have started communicating with each other. Locally, because I always think we have to use local resources. Yeah, I'm trying not to bring too much in from the outside, because to strengthen a little bit the local infrastructure. Yes. So we cooperate with CCBRT, which is a local organization that I can look for funds to pay them, and they provide, and they come here, bring the wheelchairs, and they maintain, etc. So that is our cooperation. Yeah.
Yes.
Yeah. And as I said, we're cooperating with the parent group. There is an official organization in Tanzania for parents of kids with spina bifida. So they found themselves together, and they have the headquarters in Dar es Salaam. But we also have a small association of parents up here. What we do is we're trying to support them with transport money. So when they're here during the week, everything is covered for them. Transport is covered, food is covered, to stay in the hospital, but they occupy a bed, of course, in Lena ward. So that is our big challenge at the moment, is space. After they have delivered a child with a disability. So people think it's witchcraft, so they are not allowed to come back to their communities, so they are abandoned. So they sit in the hospital with a newborn baby, with a spinal defect, left alone. Sometimes the husbands also are running away from them. So we need a place for them after the kids or the baby is recovered and saved, especially to prepare them for their return to the village. So the house will be also having some kind of sleeping rooms, a kitchen, a garden, so they can at least spend some time there, close to the hospital, so they can come for wound dressings, etc. And somebody from the hospital can take care. I could not do this if I would have not been living here and working here for so long. And I still need to come back once in a while.
Yeah,
not
because
only
if you don't come back.
not only because I definitely have to do things here.
Yeah.
I want them to take over and to take ownership. But it's good to show up because you're part of the team and to motivate people.
Ooh.